makes a duck blur, might solve a mystery or rewrite history.
Hey guys, good evening and welcome to my exciting channel. We're discussing Mandela effects and the like. Thanks for joining me today as we uncover the mysteries of the Mandela effect itself and find out the true meaning of it all. We must discover what is really happening, what is really going on here.
What difference does that make? This was a dream, a fantasy. I mean, you said just shut up, Offsetter, and tell me about the ticket is.
Hey guys, good evening and welcome to my exciting channel. We're discussing Mandela effects of the like. Thanks for joining in today. Welcome all Mandela effectings. Hey, so I've got people with us. We have, of course, we have Teresa Lynch with us. She's my residue hunter. Say hello, Teresa.
Hi, everyone.
Hey. And then we also have joined with us, we have Jessica, who is a registered RN. And she's here today to talk about some of her theories and what's going on with some of these body changes. Jessica, do you want to introduce yourself? Tell everybody who you are and or a little bit about what you do and a little bit about your experience too.
Sure. Like I said, my name is Jessica. I'm not wanting to give out my last name at this time because the Mandela effect is still a controversial subject for a lot of people. And in a professional field like mine, I don't want any stigma attached to my name. So I have graduated with a bachelor's degree from a large public university. I have been a practicing RN for 17 years with primarily experience in acute care hospital settings, as well as the trauma intensive care unit. I was going to say ICU, but I'll try to use actual words so that y'all understand what I'm saying. And then I also worked in trauma for about another 12 years in a large penitentiary environment and dealt with a lot of trauma there. But that's where I'm coming from as far as my medical background.
Yes, and thank you. I want to first of all say thank you for coming forward, because a lot of people I've found in the medical community do not want to own up to the Mandela effect. The moment you mention it, they sort of turn their back on you and give some other excuse. Isn't that right?
That is definitely correct. I've experienced that personally in my own family with, and that's been very hurtful to me because I feel like I'm very science oriented, and I have a family that is also very science oriented. That's not to say we have no spiritual beliefs, but that we spiritual beliefs and reconcile those with our scientific beliefs. And it's been pretty difficult sometimes to see that my own family doesn't even agree with the principle of the Mandela effect.
Well, one thing I wanted to ask you, I'm sure Teresa, sort of probably on the back of her mind too, when did you discover the effect, or when did you fall into it, I guess?
Yes. Well, that's sort of an interesting story. Actually affected by it before I had ever heard of it. I had been in that prison environment for quite some time, and the last 2 to 3 years was a role. So I'd gotten out of direct patient care, and then I got into a teaching role where I became a clinical instructor for LPN students. And I went in on my very first clinical day and was listening to heart tones behind one of the students. And I was having difficulty discerning what I was hearing, and she had had difficulty as well. And the patient was obese, but it wasn't enough to make it that difficult. So I had to get a floor RN to go behind me and listen to tell this student what she was hearing. So I immediately bought an electronic stethoscope that amplifies the sound by 24 times and spent $100 just so that I could hear better. And later, when I did find out about the Mandela effect through my own searching on Google, I'm very science oriented, theoretical physicist and whatnot, and I happened upon a video by a self-proclaimed theoretical physicist who discussed it. And when I heard about the changes that had happened in human anatomy later, that were a result of the Mandela effect, one of the changes was that the heart had moved to a more midline location. And then it clicked, and I realized that was why I was having difficulty hearing the heart tones. So that's kind of as to how I first was affected by it before I had even heard of it.
So, about when did you discover it? Do you know? Like, do you know where you were at that particular time when you discovered it? Time frame?
It was probably in June. It was fairly recently that I
Oh, wow.
found out about it, and I was just, again, I am interested in science, and I watch a lot of videos by theoretical physicists as well as videos by PBS Spacetime, which I love. Came upon this one video that said, you know, something about the Mandela effect, and I had not heard of that, and I thought it was just another, you know, theoretical physicist theory. So I just clicked on that, and I listened to it, and I immediately, some of the changes, like, of course, the most famous Bernstein Bears, whatnot, and I just started listening, and the more things that I could identify with. And it took off from there, and I actually to another RN talk about some of the anatomical changes, and that's what made me first aware that human anatomy, and that also made it crystal clear for me, you know, theories about the possibility of time travel or whatnot was totally not possible, because time travel would take you back to an instance in the past, and you cannot travel affect human anatomy. Human anatomy developed over thousands of years. It developed by evolution. And so you right there, you've got to rule out time travel as any possible cause of the Mandela effect, in my opinion. I know there are others who disagree, but human anatomy, you can't go back to a point in time and change that.
Yeah, because well, the way a lot of people are calling it the quantum effect. You know, that an effect changes through time and space and stuff like that. So, like, I could understand where it comes into play that yes, somebody could have gone back in time, but at the same time, why isn't everybody affected? That's the other question we have. With you on that. As of right now, there are so many theories. How many theories would you say there are as to what's causing it?
Me? I have no idea how many different theories there are. I've heard everything from the sky visitors, which I tried to ask that person to elaborate, and they weren't able to. And I've heard, you know, the time travel, which, like I said, I kind of ruled that one out. As I've just kind of had to sift through a lot of some of the theories that I think are more out there to find ones that were based in what I consider real science, actual possibility that fits in with a scientific worldview. And that's what I had to do to find the theory that I most closely identify with, which actually it was a child who I listened to talk about this. He's a self-proclaimed theoretical physicist by the name of Max Login. Login is L-O-U-G-H-A-N. And he was discussing, I think it was, well, I'm not sure everything he discussed, but if you look up Max Login and Mandela Effect, there's a 23-minute long video, basically. And he builds up to that and discusses the Mandela Effect at about the 6-minute and 30-second mark. And I've listened to it several times. And what he's saying makes sense from a scientific point of view. And it's not my theory, it's his theory, but it's based on the idea that there is a multiverse, that there are infinite parallel universes, so to speak, that are created. I'm not sure if any of the listeners understand quantum physics, but the idea behind quantum physics is kind of that all possibilities that, or probabilities, I guess the word is probabilities, can happen but some are more probable than others. And if all possibilities are being explored, it takes a conscious observer basically to collapse the waveform and create reality. Observer kind of changes reality in that respect. And you can look that up. That's very established science. It's called the double slit experiment. It's been done a million different times. There's even one called a delayed choice double slit experiment, which kind of has consistently shown the same exact results over and over and over again. Well, if you're constantly living out every possibility, then Max basically says that all possibilities are creating new universes. And if you're creating new universes at every step of every vision and every change, then you've got the multiverse with all these multiple different universes. And some are very, very close and similar to ours, and some can be radically different, but there are an infinite number of these universes. And his theory that he is shooting out there says that CERN has a Large Hadron Collider, that they smash atoms together, that they accidentally created an electron with a higher weight than is possible in our universe, and it, quote, destroyed our universe reality and shifted us imperceptibly to the next closest infinitesimally small differences in this reality.
Yes.
Okay, so we've just been shifted to the closest parallel universe, and that's what his theory is. But he admits that he has no idea why we, have some people in this reality that have memories of, the old memories, so to speak, the Mandela-affected memories, and other people have the new memories, and they don't recognize the Mandela effect or are not affected by the Mandela effect at all.
Yeah,
so that's where we are.
Do you think that some people are affected by some things, or not? I mean, it can't be that everybody's not affected. I don't believe that. I think sometimes it does take a good, sort of like awakening. You have to wake somebody up. And most people that are awake are open to new ideas. If you notice, you're not going to find a closed-minded person pay much attention to you. But we have these residues left behind, right? And it took me a while to realize that Rubik's had went from Rubik's KS. I mean, it was an IX before, and then it went to KS, which bugs the crap out of me now because I know it was IX. Chick-fil-A, I used to work there. I don't know if I told you that, but I worked at Chick-fil-A for 3.5 years back in my high school days, and it was Chick-fil-A with a C, and even my parents remember. I don't know if this is residue, but my dad into restaurants, he just writes down stuff in the checkbook, stuff like that. He wrote down Chick-fil-A with a C without the K. That tells you right there that's what he remembers.
Well, to answer your question, I think that it is
residues.
possible that there are people who are not affected. I think that it's definitely possible there are people who are not affected because
oh wow,
you talk this. Well, I mean, this is the way I see it. Is just like we, as people who say we are being, we are affected by the Mandela effect. So that, and we're expecting people to believe us based on the fact that we know what we know. We know our memories. We trust our memories. So when somebody else says that they have the memories of the way things are now, then we have to be able to give them the same trust and belief that we're asking people to give us.
There's something that Teresa wanted me to ask, and it's about the she used to be able to walk a lot more, or she can walk a lot more now without wheezing. And a lot of people are saying that the asthma's gone pretty much with a lot of people.
Completely.
Have you noticed any breathing changes? Maybe the breathing has slowed down or something like that. Have you noticed anything like that?
I don't even need an inhaler no more. I have not noticed any changes like that, but I have a list of the anatomical changes that, again, I don't want to take credit for this, but there was another RN who listed anatomical changes that I could go through. And then
Yeah,
I will
let's.
tell you the ones that I can specifically identify with.
Okay, we can do that. Let's do that.
Okay. Again, this is not my own research and work, but I will tell you when I do identify with something. She stated the clavicle, which is the collarbone, is higher and straighter. The shoulder joint has changed, although she did not specify how. The heart has become more midline, and when I heard her say that, that was when I realized why I was having hearing difficulty with a patient. There is a thin layer of bone now that is behind the eye, and I will say for sure that that is one I identify with strongly. There was no thin layer of bone there when I took human anatomy, and I never known that until she said so, and then I had to check again. I had to check my anatomy books, and then that thin layer of bone does have space for the optic nerve and the retinal blood supply to pass through, but it's mostly just a thin sheath of bone there now. Are now attached to the sternum, which is now thicker and extends further down. The sternum is that bone, your chest bone, basically, that extends down in the middle of your body. When I say anterior, anterior means like on your front. So your sternum is now thicker, it extends further down, and again, you have more ribs now, and they actually protect almost all of the major internal organs now, which was not the case before. The spleen and the pancreas and gallbladder and stomach were lower. Now the pancreas was still a little bit high, but it's not as high as it is now. And this is for me anyway. These are my memories when I took anatomy. The stomach was definitely lower, and now it's higher. And all of these internal organs I just listed are now protected by the rib cage, whereas before, they were not. And so now you've basically got the sex organs and the intestines down lower, and most everything is crammed up above the level of the rib cage now.
Can I ask you something too about the rib cage? Because there's been a lot of changes with that. Do you remember cartilage being on the rib cage at all? And it looks like a web, almost like an upside down butterfly, maybe with some webbing there.
Yeah,
some of the ribs are connected now. Do you remember any of that?
Right. The thing is, cartilage is just not quite as formed. Bone is just hard bone, and cartilage is kind of like more soft bone, so to speak. It's not the same as bone, and it's a little softer, more malleable, and so you can find cartilage in you've got lots of articulations of bones meeting bone, if that makes sense. You see what I'm saying? Like you have cartilage in all your joints.
In the joints, yes, in the joints. I remember learning in school that we had cartilage in our nose, cartilage in the back, in the vertebrae area.
Right, and basically, like I said, anytime where you're having bone meeting bone, there has to be something there to, normally there's cartilage in most areas where the bone articulates with another bone. So if there is cartilage in the rib cage, that is, again, I would not say that I am knowledgeable enough to speak to whether or not there was cartilage before and where it is now, because most of this is from the other RN's findings. And again, I'm just trying to tell you which ones I strongly identified with. I do know that the stomach, to me, is definitely in a different location. It was lower in the body before, and now it's higher because it's protected by the rib cage. Some of the other changes where the skull has new markers for articulation and muscle attachments. And there are ridges to the occipital lobe at the base of the occipital lobe, which is the back of your head. Yes. Basically at the very top of your neck. So there are a few ridges there that I personally do not recall being there when I took. But again, I'm not a physician.
Yes.
So I can't say for certain. But the one of the other ones was that the brain's medulla is now completely encased by the skull rather than protruding slightly below it. It was basically, the medulla has always kind of been encased by the skull, but it did protrude slightly below the skull, and now it's completely encased by the skull. So, and that change is definitely something to me that I have identified with, because when I worked in trauma ICU, you know, people who became brain dead, I would sometimes have to do education with families, and they didn't understand how somebody could be brain dead while at the same time being on a ventilator and having a respiratory rate and a temperature that was normal and a blood pressure and a heart rate, and they couldn't grasp, how is this person brain dead? And I'm sitting here looking at all their vital signs, and they're breathing, and they're warm, and you know, their blood pressure's normal and their heart rate's normal, and I had to explain behind how somebody can become brain dead. So I did get pretty knowledgeable about where the medulla is, because of that particular part swelling and cutting off the circulation to the brain to allow brain death to occur. But because the heart is, you know, has its own electrical current traveling across it, as long as you got that person oxygenated quickly, their heart would continue beating. Does that make sense?
Yeah, I actually wanted to share with everyone a picture of what the human brain looks like now. It looks weird. Looks like those bike helmets now that we have. Yeah, let me share it. Not sure if you guys can see this, but
I can.
yeah, and I've heard that. Now is this a change with the brain? There's a part of the brain on the inside that looks like, kind of looks like something Egyptian, like. It looks weird. It's got like a curve to it. You see it?
I'm sorry. I can't see what. I don't see what image you're looking at.
It's okay.
But
it's okay.
It sounds like you're describing the ventricles, which that was a normal part of the brain, as long as I've known. But I'm not sure what you're looking at, so I can't say for sure.
Yeah, some of these are really blurry. Trying to find one that's clear cut. Yeah, I think this is it. This may be a good one. Okay, a lot of things seem to point to the pineal gland, especially like in Back to the Future, and a lot of other movies seem to point to the pineal gland. What is so important about the pineal gland? Do you know?
It's mammary gland. Beyond that, I cannot tell you the specific things that it regulates. If I remember correctly, it regulates levels of enzymes, and that's about as far as my memory extends to that. Okay. Again, you would have to consult a physician about that, because, you know, when we cared for these patients that were brain injured, it was keeping them hemodynamically stable, it was keeping ventricular pressure normal, it was nursing considerations, and what you're speaking to is a physician consideration that I'm not familiar with.
Yeah, I'm looking at a picture of the medulla, which is attached to the pons, which is part of that brainstem. And yes, you're right. It looks completely covered inside the skull.
Well,
Weird.
The biggest change for me was one I didn't mention, and I was saving that for last, because this was, to me, the main thing that made me realize that, you know, the Mandela effect was absolutely 100% real, in my opinion, and nobody could tell me anything different now. And it was the location of the kidneys. I'm sure that many of your listeners have probably already seen something about the kidneys changing location, because that's probably the most well-known human anatomy change, because, you know, everybody kind of had a basic understanding where the kidneys were, I think even people who weren't in the medical field understood that because, you know, boxing, they talk about a kidney punch. And, you know, people know people have had kidney stones. So that was a big difference for me. The kidneys are much higher, drastically higher than they used to be. I mean, basically just top of below your waistband. And they were located posterior, that's on your back, you know, at the very base of your back. And now they are much higher. They're above your waistline.
Oh my God.
I can't wrap my brain around still.
It says here, a kidney punch is a punch that occurs usually when the fighters clinch. It's a hit that goes into the lower back, it says.
Yeah.
Into the kidney
and
area.
Yeah. And the thing is I was, you know, determined when this nurse listed all these anatomical changes. When she said that where the kidneys were, I just kind of flew up out of my seat. I was like, that is not right. And I went and got all my anatomy books from when I was in school. And I got all my children's, you know, human anatomy books. And I've got lots of other science books that have human anatomy in it. And I even have a jigsaw puzzle of human anatomy. And everything that I came across now was showing location higher than what I had learned, which was unfathomable to me because I'd never even heard of anything like that. And I will say that when I worked in the trauma ICU, on occasion we had patients that were called open abdomens, and they had to be left open. It's exactly what it sounds like. Their abdomen had to be left open to allow for swelling, and also in case the surgeon had to go back and fix something that he missed. Like if they had a lot of internal trauma to the intestines, we had, you know, stabbings or gunshot wounds, and they had to have that room to swell. And if you didn't allow that room to swell, then the tissues would be too compressed and the abdominal cavity was not large enough to allow that swelling to occur. So the compression would cause ischemia, which is lack of oxygen to the tissues, and then you have necrosis, which is tissue death. So these patients were left literally open from surgery and brought to us with a sterile tegaderm dressing covering their entire abdomen. But you still had a clear visual sight line to the internal organs. So, you know, I worked in trauma ICU for over a year, and I saw multiple open abdomens during that period of time. And so it wasn't just what I had learned about where the kidneys were, it was what I had seen with my own eyes. And that has apparently changed.
And, you know, we go into some of these theories, and I mean, we want to know what's causing it, right? I mean, we're wondering what's causing it. Why do you think this is happening? That's one of the questions that we proposed before we started the show. What do you think is happening here?
Again, like I said earlier, I mentioned the child prodigy, Max Login. He came up with the theory, so I can't claim any credit for it, but I listened to what he said, and what he said made a lot of sense. And again, he speaks from a point of view as somebody who knows that the multiverse is something that many, many theoretical physicists believe is real. And they're, you know, basically saying that quantum physics strongly suggests that there is a multiverse, that basically all different possibilities are existing, and each possibility is being explored. And if that's true, then, you know, it's branching off and creating multiple universes. And one of the ways I like to explain this to people when I talk to them about this is if you're ever driving from one city to another and you're listening to the radio, there might be a time where you can hear two radio stations at the same time. I'm sure that's happened to y'all. Has that happened to y'all? Yes.
Yes.
Yes. Okay.
Yes.
Well, you know, though, that there aren't just one or two radio stations that are available right there while you're in that space. There are multiple different radio stations. You can change the channel anytime you want to, and they're all operating at different frequencies. And that's basically what the multiverse is like, is that you've got multiple frequencies of reality in some people say in the same space, and that you're just experiencing one reality. You're experiencing that one frequency because that's what you're tuned into right now. And so Max suggests that, and again, this is not some evil plot by CERN. In his theory, this was completely accidental. It was a side effect, unintended side effect of the Large Hadron Collider collisions of atoms. He thinks that an electron was created with a higher weight than is possible in our universe. So it shifted us to a universe where that higher weight was possible and kind of kicked us off of our timeline, if that makes sense. That's the simplified explanation. I think that theory sounds more realistic than many of the other theories because it's based in real science, and there are multiple theoretical physicists who the multiverse is a very good possibility. Of course, there's also the simulated universe theory, the ancestor simulation theories that say we're all living in a simulated environment. And I'm not sure that a society as advanced to the point where we are, if we ever got to a post-human point in the universe where we were living outside of our bodies, at what point do you think that people would really want to go back and simulate like ancient history? And it'd be like us sitting there watching ants our whole life. Why would we be interested in doing that? I don't know anybody who does that. So to me, I just can't get with the simulated universe theory, just because it doesn't make sense. If you've got a society that they have better things to do with their time than watch us their lives, that to me doesn't make sense. But this other one does. It makes a lot of sense to me. And again, if you look at quantum physics and you listen to the theory behind it and the multiverse theory, and you can watch these on science-based channels like PBS Space Time, they all discuss this, and it's based in quantum physics, which is very well-established science, since the 50s. So this is not, it's not a new discovery. Known about quantum physics for ages. Again, the quantum physics point of view says that, there's, they talk about the collapse of the wave function. What they mean by the collapse of the wave function is that a conscious observer has to be looking at it and know that they're observing it, and that conscious observer collapses the wave function, and then the path is determined by whatever they're shooting. They could be shooting a photon, they could be shooting an electron, they could be shooting, they've even been able to duplicate the double slit experiment with buckyball molecules, which are fairly large molecules. So what they're fuzzy on is where does this change from the quantum world to the physical world? Because we don't throw a ball at two slits and watch it split and go through both of them at the same time. Even if we close our eyes, that's not what's going to happen. But that's exactly what happens when you go down to the quantum world. If you shoot one single photon or one single electron and nobody's looking, it goes through both slits. I mean, that's just what happens. It's as weird as that sounds. You can just look up the double slit experiment, or my favorite is the PBS Space Time video that's titled "The Experiment That Broke Reality," and that's exactly what it did.
Reality, I think reality used to have some boundaries, did it not? It
Yeah.
seemed like it had, like we had natural laws with reality,
Yes.
but now it seems these laws have been broken to allow these things to happen. We're seeing lots of spiritual things going on here. I myself, I don't know if you've looked me up at all, but me and Rena had a spiritual experience where an entity entered our phone call, and we rebuked the evil spirit in the name of Jesus Christ, and this thing was evil. Okay. I think there is some kind of universal law when it comes to these spirit beings, that as long as you follow Christ and everything like that, you know that these things they have to leave you alone, or they have to give you the correct answers to things, and you have to ask, or if you have in the name of Jesus Christ, and they have to tell you, you know. Have you had any kind of spiritual experiences like that at all since the ME or before the ME that happened to you?
Not what you're describing. However, I have had a couple things happen when I was younger, but I was, probably a teenager, and for whatever reason, I never had anything like this happen later. That definitely was outside the boundaries of scientific explanation. I did have one instance where I woke up around 2 o'clock in the morning and was certain that a friend of mine there was something wrong with her. That's all I could verbalize. And I had another friend spending the night with me, the girl who I was concerned about. And I woke her up. I was so distraught. I woke up. I said, there's something wrong. Lee, I'll go ahead and say her name. Her name is Lee. I'm not going to give a last name. And I said, there's something wrong with Lee. And she was like, you just had a dream. Go back to sleep. And I was like, no, this was not a dream. There's something wrong with her. And I was adamant that there was something wrong with her. And then I even said, and I think it has to do with her appendix. Now, this was before I ever took any anatomy course. This is before I took biology, probably. And I had no idea what an appendix was. But she insisted that I go back to sleep. She would not let me call Lee because that was pre-cell phones. And if I called her home back then, her dad would have answered and said, why are you calling my house at 2 o'clock in the morning? So I did not call. And the next day we got a phone call. And, it was her boyfriend saying she had had an emergency appendectomy. And
my God.
And it was apparently she had been, she had to go to the hospital around the same time I woke up. So, but that's the only time anything like that has ever happened in my life. And
okay.
Of course it can't be explained away. The thing is, what's weird is it's not like she was my twin or my BFF. She was a girl who I sat with at lunch one year.
Oh, wow.
We weren't even that close of friends. So there really wasn't any explanation for it. And honestly, I probably would have blown the whole thing off and thought that I had just had deja vu or a vivid dream the next day. But if it weren't for my other friend's presence, and she was with me, and she could verify that indeed did happen. So
yeah.
So that's something that kind of stuck with me through the years as, like, obviously there's something more to this world than what science can explain. And
I know. And
that's just always been there. And then also, I will say one other thing. As a nurse, I have had a patient who experienced what they call a near-death experience. And he was so excited about this. He was like some 70-something-year-old man, and he had been a lifelong atheist. And he had some sort of cardiac arrest and was in the ICU. And then he had been transferred to the med-surg floor where I was taking care of him. And he was just so excited about it. And he wanted to tell everybody. As soon as I stepped foot in his room, he was like, you need to hear about this. And he told me all about it. And it had just apparently happened to him when he had this cardiac arrest. And he was 70-something years old. You don't normally see somebody at that age all of a sudden become a firm believer who has been a lifelong atheist. So that was an interesting thing. And then, of course, then I worked in ICU, and I saw examples of, you know, people who had very strong faith, and I thought, you know, that's something I want. I would like to have faith like that. I would like to be comforted like that. And so I started, you know, I was, again, very science-oriented family. I wanted to learn more. So I read, I think it's Raymond Moody's book about near-death experiences of children. And I just learned a little bit about that. And I kept on seeing, in fact, you know what? This is actually how I got into quantum physics. It just occurred to me. I've been reading near-death experiences, and there's a site called Near-Death Experience Research Foundation, but it goes by the acronym. It's www.nderf.org, and it's a site that is where people can, from all over the world, about their near-death experiences, and it's kind of in a format to where they're allowed to give a narrative, but then they're asked specific questions for clarification. And I read more and more on that site, and I kept seeing the actual word quantum or quantum physics popping up. Maybe once every 200 stories, somebody would have developed an extraordinary interest in quantum physics after their near-death experience. And that is what set me on the path to learning about quantum physics to begin with. And it was because I was reading about these people who had come back and started talking about this new interest in quantum physics. And these were not people who had any science background. I mean, one was a gas station attendant, somebody else was, you know, a fast food employee. But all of a sudden they came back and wanted to know everything about it, or they seemed to understand it. And I thought, there must be something to that. And that's when I started looking into quantum physics, and that kind of became a hobby of mine after that. And that's several years ago. That's probably 4 or 5 years ago. But I kind of forgot about how I'd gotten into it until we just started talking about it.
Yeah, I think so. That led you on the path to discovery, you know, your own, and you know, sort of.
I'm a strong believer now. I'm a strong believer in God now. I think, in fact, the more you learn about our universe, the more you learn about especially theoretical physics, quantum physics, the more you end up with the inescapable conclusion that God exists, that there is a creator. I don't think that you can come to any other conclusion after you really get into the science of it. And that's what my experience has been. And I think if theoretical physicists, but I think the majority of the ones that are reputable and are well known in the field do have a very strong belief in God. And of the universe, the more in awe I am, and the more I respect God or the light or whatever name you want to give the entity that, you know, created all of this and created us, and apparently knows about the Mandela effect but won't tell.
It was an interesting point there, and like I'm reading some famous quotes, and Carl Sagan himself said that science is not only compatible with spirituality, it is a profound source of spirituality. So I do think that there are things that just science cannot explain, at the same time can lead you to the creator, you know?
Absolutely. You just nailed it. What he said is so true. That you summed it up perfectly, really, with Carl Sagan's quote. What can't you attribute to Carl Sagan? I mean, he's done everything. He gives us great quotes and everything.
Yeah.
But yeah, that's exactly what it is that I feel like that there's no way God doesn't exist. And I kind of wish that the theoretical physicists would get with some of the people who are studying metaphysics and the people who are studying near-death experiences. And I wish they would kind of have a group meeting, because I think that they would get what they're trying to seek is a theory of everything. The theoretical physicists, like they're what is that? Trying to think. Their one thing that's out of reach that they're all seeking is a theory of everything. They all want to be the one who has the theory of everything that ties it all together. And, you know, like I said, I really think that until they all communicate with each other and they look at it not just from a physicist point of view, but from a metaphysical point of view, or a spiritual point of view, and tie all those together, they're not going to get it right.
Well, there's another thing I wanted to ask you too. That seems kind of important here, as far as like dosage goes and stuff like that. You know, do you agree that the types of changes that would indicate have happened would not actually have an effect on medicine dosage, or does it that changes? In other words, like, why is no one dying from the wrong amount of like medicines? Because dosage doesn't need to change.
The thing is because medication dosages are typically determined by, and your body weight is your body weight. So thank goodness so far that does not seem to have changed. And they do drug calculations based on that.
So it is a function. It's obviously based on the person's weight, and if the weight changes in one reality to the next, then obviously the amount of dosage would change along with it.
Every time you go to the doctor, right?
Yes.
Right.
Yeah, they always do that. That's part of like basic operating procedure, right? Everybody gets checked with their weight.
You know that every time you step into your doctor's office, you step on the scale, and and you know whether you want to or not, that's what you do. So
and they check
you go
your
to the
blood
hospital.
pressure.
So and plus, really, to be honest, weight is more critical with people who are really elderly and might have impaired liver or kidney function, and the very young and children, who that is when you really need to be exact. But you know, with most adults are in a certain range, and most medications come in particular. Most doctors, to practice safely, they'll start you out at the lowest dose that the medication comes in, and then gradually increase it over time. So that's part of why you're not seeing any problems.
Okay, so in that case, they cover their backs as well.
Right. I mean, I have great faith in the medical community. I'm a member of it, and I feel like they pretty much try to get it right. Of course, that's not to say that you shouldn't always have a loved one with you every time you get admitted to a hospital. That's another thing. I think everybody should always have somebody with them when they're in the hospital, just because that's not to say errors can't occur.
Yeah, and you mentioned can occur. I mean, one question is how there hasn't been much malpractice, thank God, of course, along with the ME changes. Not to my knowledge, anyways. What about you? Have you discovered anything like that? I mean, so everything seems to be in check along with the effect. It's almost like time has sped up too, and that's another whole story.
I can't say that I feel that particular effect. What I will say though, as far as malpractice, when you say malpractice hasn't increased, what people should know if they don't, is I think that the medical community said that over 100,000 or 150,000 patient deaths every year in the United States are preventable. You know, malpractice, that's a different word entirely. That's talking about a lawsuit or charges that are being filed. And so we have tons of preventable deaths in the United States every year, but that's not necessarily because of malpractice. It might be because that patient didn't have health insurance. So they didn't go to a doctor until their disease state was so advanced that there wasn't anything that could be done. Do you see what I'm saying?
Yes, and that's another question.
And hospital-acquired infections is another one. That's another big one. And then there's preventable causes like in nursing home cases with dehydration. So, yeah, you have some really big ones that stand out that are preventable.
Well, I wanted to ask you, which what you said about health insurance led me into the next question, because a lot of people seem to remember HIPAA being different. How do you remember HIPAA? Do you remember what it stands for?
It's Health Information Patient Portability Act, and some people say Health Information Patient Privacy Act. That's one of those ones to remember it being Health Information Patient Privacy Act, but I've seen portability as well.
Yes.
And I can't remember when I started seeing it.
Yes.
So I don't think I ever, it was long before I think I ever recognized anything about the Mandela effect. So it, to me, I just thought that, oh, it's the same thing. And I just thought the hospitals were using different wording for their own policy record keeping. You know, I didn't really take note of when I started seeing that. Do you see what I mean?
Yes, I see what you mean. And it's funny, both times, no matter which way you said it, it was HIPPA. Now spiritually, and now it's HIPAA. You said it was HIPPA, so that means you're remembering a lot of the same things we remember too.
Right.
See, it totally, it's bizarre.
I remember.
It's really bizarre, and see, I tried actually changing it on Wikipedia. I actually changed the entry a couple times, address for a little while too, because I changed it to the way we remember it, and I even took a few screenshots just to be funny.
Weirdest thing that's happened to me since I learned about the Mandela effect. This was again when I was first learning about it, and I was stuck on Looney Tunes on this particular moment in time, and I was like, Looney Tunes was TOONS, and I was adamant that it was TOONS, and I was gonna find what occurred to me, because I couldn't find TOONS anywhere. It's TUNES now. So I thought, oh, what about Who Framed Roger Rabbit movie? And I know that there was a scene where it had Looney Tunes, and so I went back to find that scene in the movie, and lo and behold, that movie scene has changed, and it says TUNS. But I did a Google search and wrote, what happened to Looney Tunes, TOONS, and I put it in direct quote marks, because apparently if you put in the quote marks on a Google search, it has to find that exact wording. So I did this search, answer down, said exactly what I wrote. What happened to Looney Tunes, TOONS? And so I clicked on that. I clicked on that second entry, and I saw that the next page was useless information. It didn't say anything useful. So I hit the back button. The amount of time that it took me to just go forward one page and then back, it had changed to TUNES.
Yes, yes. Teresa sent me some residue on Fruit Loops, and all the residue changed literally overnight.
Well, this happened literally. I mean, I didn't see my own eyes transform, but I hit the button. It went forward to the next page. When I hit the back button, it was different. And it was a direct quote, and it was the second entry down, the same person, same question, but the spelling had changed in like 2 seconds.
It was like it was trying to correct itself.
Yes,
it didn't want you to see it.
It's exactly. I thought that's what I saw.
I know you guys are. I have to tell you something. In the last 3 months,
it's okay.
I've been literally watching residue change in front of me, like literally change. And I don't know how to use this word without saying it's stupid. Warp. It changes in front of me. I literally watched it. I've observed it.
Can I ask you a clarification?
Go ahead.
Huh?
I just want to ask you something, Teresa. When you say you observed it, did you go off the page for a moment like I did, or did you actually see the letters change?
No. Watched it change.
Wow. That's really
Yes. It freaked me out. I literally saw a picture of a restaurant, and it said Chick-fil-A, Chicfila, and I'm looking at the sign, and I'm like, oh, looky, residue. Well, I'm going to take a picture of this. I didn't even get my phone up yet, and I'm staring at it like, okay. Keep staring at it and watching it, and within seconds, it changed. Like, literally, you see the cave just pop up there. It's like it was like a new picture. Same picture, decided, you're not going to get anything. And it also did it for Mellow Yellow. I don't know if you realize Mellow Yellow. MELLOYELLOU. Excuse me, Mellow Yellow. They're like vanished.
Yeah, and
Several times.
and we go through.
That, to me, that is mind-blowing, because that is the part where theory doesn't fit. If you see something like that, and like what happened to me when I went off the page and then went back, I'm like, now, is that happening? I would really love to hear what a theoretical physicist has to say about that, because please explain that in a scientific way for me, because I don't know how that happened to me, and I've
it freaked me out. I was texting Brian, going, Brian, oh my God. And I'm at work looking at this on my lunch hour, and I'm like, next to me is a non-Mandela, so I'm like sitting there silently freaking out.
Right. That's what I felt like. I felt like, this is so weird, and I had that moment of
Residues, he found it.
Yeah.
And I've done
like
quotation things, just like Brian had taught me that.
Right, and what you just said was right.
Yes.
I felt the exact same way when I hit the button, saying the same question.
And I didn't get off the screen. That's what's so funny. I visually watched it change.
Yeah. The only other thing I've heard about that was the Back to the Future clip. Did y'all see that video clip? Symbol change.
Yes, it like changes in mid-play too.
Yeah, and I mean that's just really weird when you get into that.
Freaked me out.
Yeah,
and I have no way to physically explain that.
How do you explain that?
And I don't smoke or drink or do drugs or anything.
Right, and neither.
I don't either.
Wait a minute, did I just visually observe this? I didn't
Here's the thing. Here's the thing, guys. Can I ask both of you something? If residue to explain our remembering, we have that there's a particular item. Why all the skepticism behind shadows? And they're just maybe.
You know
what's the answer to that?
Yeah, well, Teresa, you go ahead and answer. I've been talking a lot, and then I'll give you my answer.
Okay.
Well, I'm saying, Brian, like, if residue didn't exist, then we know it had, if it's there, then it had to exist at one time.
But what about what he said about the people? He just asked, are they who are blind to it? I mean, what?
Sleep.
You know what I'm saying?
I don't think they're aware. See it. Like I don't know if he told you, but every time I get a chance, I wake up people who don't get mad at me. Most of them are like, "Oh my God, you're right." I don't do it in a way to scare them. I ask them if they believe in science fiction. Different. I don't do
so you screen them first before you push it. Yeah.
And I wake people up all the time.
Yeah, she does. She does an awesome job at it, Jessica.
Especially with my dad, strange, because my dad, person who he had some national math test that college students who are math majors take. highest score in the entire nation at the time. He went on to fly fighter jets, and then he became a commercial airline pilot and retired as a captain. And he's also interested in, he's read all Stephen Hawking's books and whatnot, so I thought I could have a reasonable discussion with my dad about this, right? Wrong. So when I talked to my dad about this, I would ask him, fill in the blank, and then I would say something, but then I would leave the blank for him to come up with, because I didn't want to ask him, is it this or is it this? Because then, I just wanted him to have a blank slate answer. You know what I mean? Do you know what I'm saying? Instead of saying, do you remember depends? And I would say, brand of briefs that we bought for Granny when last 3 years. And it depends, you know, and I was like, no, it's actually now it's called Depend. And so I went through a series of questions like this, and literally single answer my father gave to me answer. But the second I told him the correct answer and the new, he automatically swapped to the new memory. He was like, oh, that's right, that's right. I remember that now.
Yes, it was an upgrade.
Single
upgrade. That's
and
what
I
happened.
was like, it's the most incredible display of denial I have ever seen in my life.
I don't think people want to be, how do I explain this? People are
after
in
you,
their,
can I say something, Teresa, too?
And they don't want to have their reality messed with.
It does.
It's thinking that this is the way things should be.
Right. Well,
Yes.
Well, it doesn't. My family thinks.
Well,
you know, my mom called me a French thinker, and I was like, really, Mom? Really, me? Because it's not me, Mom. You know.
y'all briefly because
matter of
time before they wake up. It's all. I mean, it's all going to come.
2 years. I woke up last year before Christmas time when my stupid spelling on me, and I've been a completely different person since. Yeah.
Well,
and literally, they were sitting on the shelf for like 6-7 years. I have 2 pairs of them. I was spelling one day on Facebook, not knowing what Mandela was. This sketch was not spelled right, and for my own curiosity, I'm like, what the? And this is before I even knew what Mandela was.
Right.
Look at my own.
It's
Wizard of Oz with a gun in it, and an interview with a vampire, and all those other ones were. I strongly identified with those.
Since then, it's like they find me, right, Brian?
Yeah, but there's one thing about Chick-fil-A. Can I say about Chick-fil-A, because that one's a real strong one to me. Company, and Chick-fil-A never had a K. With my old boss, I actually went in there, and I interviewed him. I said, "Do you remember?" He says, "You mean with the C? Like, do you remember Chick-fil-A when it had C?" I said, "When did it change?" He said, "Oh, it must have been a few years ago." Graph at 1967 with Chick-fil-A with a K. I think he sort of wanted to run away. He didn't want to face the truth. Wake people up. It's just how to do more like Teresa and sort of screen them a little bit. Do you believe in science fiction? Do you, you know,
a different approach?
A little bit different approach. I do.
Can I?
Go ahead.
Hey, Brian.
Yes.
Tell her about my favorite call to the Fruit Loops people. For that one. Tell her about that call.
Do you want to hear about that? Do you want to hear the?
Listen to that one?
Did you want to listen to that one real quick?
It's awesome. Explain, set it up there first.
We called Voodoo Donuts.
Explain that one to her.
We called Voodoo Donuts, and we were asking for loops, and the woman agreed to it. Yes, it's based off the cereal for yourself.
Basically, they sell donuts there, things on it, and the ones that she sells are Fruit Loops. It's UIT, and I kept repeating spelling back to her because I know darn well T, and now when you go into the grocery stores, FROOT. Awesome video that I did with Brian. We'd love to share it with you if that's okay.
Yeah, I'd like that.
I'm proud of this one.
Correct, right? Okay. The Fruit Loops is FRUIT, correct? Okay. I wanted to make sure of that. It is FRUITLOOPS, correct? Awesome. We definitely want to come and try your Fruit Loops donuts. I've never had them before. Okay. Really hard to find anything, right? The Fruit Loops. They have the Fruit Loops cereal on them. Like, right? The Fruit Loops that are on the boxes. This is the exact same one. Same. Oh my God. That is so awesome. Again, it's FRUITLOOPS, correct? Yep. Awesome. Oregon?
Oh.
2 locations in Oregon.
I want to share one with you also. I did a cold call to Oscar Mayer, actually, which is Kraft Foods. Can I share that one with you too?
We do a lot of these cold calls.
Right. That's fun.
It's fun. It's so fun.
Here's the cold call to Kraft Foods, which is Oscar Mayer. This one was great.
All information.
Oh, sweet. Okay. We'll get maybe reporting oddities. And
Okay.
I remember this song. Like, do you remember it? My hot dog has a name. It's OSCAR. I said my
hot dog,
has
sorry.
a second name. MEYER. You remember that?
I remember that from when
But the
I
only
remember dancing in front of the TV.
well, the only weird thing is about this whole thing. So you remember it MEYER? Is that right?
Yeah.
All
Jeez.
right, look at the logo now. It's MAYER.
Yeah.
And yet it's always been like that. That's the strange thing about the Mandela effect, is that there's these things that we remember. I'll give you another example real quick, because I'm trying to wake people up. I'm a reporter, okay? With the cornucopia. Do you remember that? Corn of plenty coming out of the fruit of the loom.
No, I don't.
You know, fruit of the loom
Give her a
underwear.
minute.
You remember the cornucopia?
Oh, okay, yeah.
Yeah.
The underwear.
Well, that cornucopia has never existed in this reality. If you look at all of the commercials in the 70s and 80s and everything, you will never see a cornucopia on the fruit of the loom.
I'll have to look into that.
Well, another thing, a recent find was that, okay, do you know Gatorade's slogan?
Yeah.
What was the slogan? Was it, let me ask you, was it,
Can you repeat that?
okay, I'm sorry. Yeah, the Gatorade slogan, was it quench your thirst or thirst quencher?
Quench your thirst.
Exactly. See, you're on the same time frame I am.
Did you hear that?
Yes.
And then there's my newest discovery that I found today, and it's interesting. I think these synchronicities are working hand in hand with finding the new effects I'm leading to right now. So we're talking, and I was on my way to a job to do a printer repair, and I was on my way there, and my mom told me to put on Shop of Horrors, you know, because we were watching Little Shop of Horrors, the movie, the other day, playing it, and the songs play through, and there's a song, you know, the dentist one, you know, and then a few get a message from Teresa, I'm at the dentist, or at dentist, which is bizarre. And then another one, when I shared this same message to someone else, which her name is Rena, you know, we all deal with the effect together. We're sort of
you know, in it together and everything. And you know how you are with your Facebook friends, and you guys connect. Rena had the same. She was on the phone with the dentist's office. I found out with Aspen Dental.
It's bizarre.
At the same time.
Yeah.
How is that possible? And we're not even twins. We're not, you know, like you said, we're not related or
About our
anything.
grandmothers having the same day that they passed away.
My
That's
grandmother's
bizarre,
birthday,
too.
my grandmother passed away, and her grandmother passed away on the same exact day, September 3rd.
September 3rd.
Not the same year, but the same
Didn't even
day.
know that.
And I mean by the synchronicities, I've had so many. And since the effect,
Me
I've had
too.
way
It's
more.
bizarre, and it's-
So let me just say
Yeah.
that one synchronicity about the dentist, to look up, I was thinking Shirley Temple. Something came to me to check Shirley Temple, so I listened to the song where she's talking about on the good ship Lollipop.
Mhm.
You fill in the rest, because I don't want to give it away. Good ship Lollipop.
Lollipop.
It's a
Hold on.
sweet trip.
To the candy shop.
Yes.
You remember?
Oh my
Yep.
God, you remember it
Yeah.
because it's a candy shop now.
Yep.
She says now if you
No,
listen
it's
to her
to the candy shop.
exactly, and now she says to a candy.
Hear it. Let her hear it.
You want to hear it? Yeah, I know you're not going to believe me, but I just found this today.
Oh, I believe you. No, I brand new Mandela. Find them every day.
Man,
like,
they're
seriously.
just.
Like I do where I go, I find
It's
them.
from the movie Bright Eyes, by the way. Let's see. It'll play.
I'll be a
It's a simple
pilot.
one.
You, how would you like to be my crew? On the good ship, Lollipop, it's a sweet trip to a candy shop where fun runs.
Oh my God, she said it.
Yeah.
She said
Hear
A
it?
or She said not
Yeah,
duh.
I heard it, but that's not the right version that I remember.
I mean, are we dealing with two different versions here? That's the main question. But then you go and look at another cover. There was another cover by the Danglings, I think, which covered her. And they say it also on the good ship Lollipop. It's a sweet trip to a candy shop. That's weird.
Right, and that's the newest thing that has happened with my husband and I. Is we both noticed a couple different instances in the movie Tombstone that have changed that I've not seen on
God.
any website. I've not read about.
What's the effect?
One of them is a scene when all three of the men disembark off the train with their wives, and they stand in front of the mirror. And then there's the other one, which I'll actually let you try to fill in the blank on this one. Are you familiar with the movie Tombstone at least?
I've seen it twice. What about you, Teresa? Do you know that one really well?
I won't be able to get the exact quote. But
it's okay. I can try.
I was a huge Tombstone fan. And there's a scene where Doc Holliday is falling down while he's playing cards, and he's coughing, and of course, he's got tuberculosis. And anyway, Wyatt Earp helps him to his feet, and he says, "Are you all right, Doc?" And he says, "I'm right as," and then you can fill in that blank. Rain? And yeah, right as rain, right. And now the quote is, I'm right as the male. What? It doesn't even make sense anymore. Are you telling me right as rain changed? Yes. No way. Yeah, my husband and I caught that watching it, and that's the first time we've caught it. No way.
No freaking
It's always
way.
been right as rain. Yeah, I know. I love that movie. I've seen it a million times. And that's the first one.
Wait, hold on. What is it? Right as rain?
Right. He says, "I'm right as rain," and I remember my memory. And then now he says, "I'm right as the male." What?
Wait, the male
doesn't
is in.
make sense.
No.
I know it doesn't make sense.
It's always been right as rain.
I know.
All right, well, that's from the movie
Brian,
Tombstone.
I know that one 1,000%. I look how fast I said it, right?
Yes.
Oh my
and
God,
The
that's
thing is
crazy.
the other one doesn't even make sense. I mean, who says I'm right as the mail? I've never even heard somebody say that.
Some of these Mandelas are really stupid. You know, some of the ones that are changing don't even make sense. Oh, the California Dreaming one. Do you know about that one?
I
I
began
got
to
down on my
pray.
knees and I blanked to pray. That one really made me mad.
No, I'm not familiar with that one.
You know the one that she goes, I stopped into a church along the way and I got down on my knees and I blanked to pray.
I know. I can't say that I do. I'm sorry.
It was
not familiar enough with
begin.
the song.
Oh, I'm sorry.
Yeah.
It changed from begin to pretend.
Yeah, I know the song. I just don't. I mean, I haven't heard it in forever, and I could never be.
Oh, I'm sorry.
Yeah, maybe if I was listening to the song and somebody stopped it, I might be able to come up with that. You know, but
Yeah.
not just
What
talking.
about Private Eyes, Brian? Does you know the Private Eyes song?
Yeah, Private Eye. Do you know, is it Private Eyes are watching you or Private Eyes they are watching you?
I don't know that song.
Okay.
I remember
Sorry.
I remember Private Eyes are watching you. And how about the
Me
one,
too.
you know Hall & Oates, there's another famous song. She only comes out at night or she always comes out at night? Which one is it? The Man-Eater song? You know that one? Oh, here she comes. Watch out, boy, she'll chew you up. Whoa, here she comes. She's a man-eater.
All right, what's the part that you're? I mean,
But
yeah, all
it's
that
the
sounds
very
right.
it's the very beginning. I remember only comes out at night.
See,
and now it's
I mean, the chorus I might have been able to tell you, but no, I can't tell you the rest of it now. Sorry. I'm
no,
just
that's all
not,
right.
like, again, with these, I have to, I mean, the ones that I identify with the most are the ones that everybody identifies with the most. You know, about,
Breeze?
Well, she's talking
Hello,
about the
Clarice,
songs.
when Anthony Hopkins
Oh, the
says
Hello
that.
Clarice. Yeah.
The Matrix movie and C-3PO changing colors and Luke, I am your father, all the ones that everybody knows. Those are all ones that I know too. Like they all, I identify with all those strongly. And then, you know, Jiffy peanut butter, all the ones that people pretty much. Now there are some I can't say for certain, but I mean, I definitely identify with most of the main ones that everybody knows.
Jiffy. Right, Brian?
Yeah. But I just kind of wanted to bring this to a little bit of a close here, and I know we can go on and on about all these effects.
Right.
We have to get to the root of the problem, though. If it even is a problem, it might be that we here because something terrible might have happened and something brought us here to save us, or maybe our bodies are being upgraded. A lot of people are saying they're losing all this weight too. There's been some changes maybe with metabolism. I feel. I know that when we go through a hard shift, I get like sort of like symptoms of IBS, maybe, or something like that. I get those symptoms.
Are you still there?
Yes, I'm here. Whenever like there's a major shift, I feel like I get some symptoms of like IBS or something like that. And I know we had a real hard shift. I'm pretty sure back in around October, November last year. And then,
sorry, you just completely cut out on my end for about a minute.
Okay, sorry about that. What I was saying was every time we go through a hard shift, I get some symptoms of irritable, I'll just say IBS when it comes to this stuff. So that's when I know and of course I'm not feeling sick or anything. I just get it, and it's not due to food poisoning or anything like that. Anything I ate.
Right.
And I know we had a real hard shift back in October, around October, November last year. And that's when I noticed like virtually every logo like going through a second change, not just one change, but multiple changes. And you know me, you probably seen my videos, before you came on the show. We deal a lot with logo changes, and that's pretty much been my stomping ground. But
right, and the Chick-fil-A, I do have the same memory you do of the C without the K.
Oh my God, yeah, and see, even my name tag changed. I had a scholarship from Chick-fil-A, And even my scholarship changed. It changed to the K. That's so bizarre to me.
Yeah, that's, and that's I guess one of the first things I checked when I happened upon the Mandela Effect video, and of course one of the very first things they talked about was Bernstein Bears, and well, we had tons of Bernstein Bears books growing up, and I kept all my childhood books, and so I just went out to my own bookshelf because I saved the books from when I was a child for my children. And I pulled them off the shelves, and it had changed to AIN, and these were books I owned since I was a child. I've got like the Spooky Old Tree, copyright 1978, and I checked it myself, and it all had changed, all the ones that I grew up with, and I knew that was the spelling. I knew how to spell Bernstein Bears. I did not have a problem spelling growing up. I did very well at spelling, and in fact, my mom was an English teacher, so she wouldn't have let me get away with any spelling inconsistency. So, I mean, and Curious George not having a tail, that drives me crazy.
Oh, I get residue for that one.
Oh my God.
Yeah.
Yeah. He totally had a tail. Teresa, you have that residue? I'll share it with everybody. The one it's kind of blurry, but you can see the tail is there. He's got his face in his palms, and he's
How
like.
are you guys looking at videos and pictures, and I can't? I don't understand.
I'm on Hangouts. That's why I can share the view with people.
Oh, that's why I can't see anything. Okay.
Okay, can you see it,
wondered.
Teresa?
No,
Hang on, can you
you're
find
gonna
it?
have to send these stuff to me.
Okay.
Or something.
I can try to scroll up.
I just sent it.
Oh, you did? Okay, it takes a minute.
To me?
See it?
Um.
Hold on. I just sent it. It's a little blurry. I'm sorry.
Yeah, it's fine. That's the one. That's the one.
I can't access it right now. But I did want to say something though. Is that one of the principles, the basic quantum physics principle 101 about the double slit experiment, was that it takes a conscious observer to change the behavior of matter. And so literally the conscious observer changes reality, at least on a quantum scale it does, and with photons and electrons and some molecules and whatnot. So I keep coming back to the fact that Mandela effect seems to be something going on with people's memories, which are part of their consciousness. Excuse me. And so what I was trying to figure out is that I have people that I grew up with in my life that grew up around me, and I saw them on a regular basis, if not every day. And one of my friends in particular that I talked to about this, he has all the new memories, like all the new memories. And it makes me wonder, how is that possible? Because I was around you all the time, every day, and shared memories of all the things we've done together, and growing up and playing football and soccer and swimming and going on trips and whatnot. But you have all these new memories, and he was just rattling off the new memories every time I asked him. And I was not asking him with leading questions. I was asking him like I did with my father, just fill in the blank. And he was giving me all the new memories, and I was trying to figure out how that happened. And I came up with kind of a theory that, like, we have, if the theory about the parallel universes and multiverse and the shift to a new reality or timeline, if that theory is correct, then when you merge with that other you on that reality, then which consciousness, that's your dominant consciousness. So when I guess we merged or shifted realities, this dominant consciousness swapped for these memories to the new ones,
Well,
to that timeline, if that makes sense.
Yes, and I consciousness, I was sort of thinking about that phrase, you know, like our parents used to tell us, you are what you eat. And then, which kind of brings me to Rene Descartes, I think, therefore I am. And see, we become whatever we think. But it can't explain the Mandela effect in that respect, because it's happening to everybody, not just one person. It's not like an isolated incident. This is happening across the board. So,
I mean, it's definitely affecting, I think, millions of people, whether they know it or not. But what I can't quite figure out is why it doesn't seem to affect everyone. And that's also what Max Logan, or or however you pronounce his name, he can't figure that out either. That's the million-dollar question: is why is it that some people do seem to genuinely have these new memories? And that, like I said, I feel like if we are expecting people to believe us about what we know, then we have to believe them when they say they know what they know. If they say, no, I absolutely remember Jiffy was not Jiffy, it was Jif, it's always been Jif, it was never Jiffy, and that's a false memory that you have, I have to believe that that is their real memory.
Well,
so that's...
Can I say something about that too? Because not everything seems to have changed at once. Like there seems to be some things that have been changing throughout the whole history that we know of it. And there's one thing in particular, when you mentioned Jiffy, because I spoke with Jinx Cat, and she's very much into this field of like medical. She does it all. And are you aware of Jinx Cat? You know who she is?
Sorry, I don't.
She's a big YouTuber as well, and she came on my show, and she remembered changing to Jif sometime around 2004 or 5 for her. So that would explain why so many people, and I think especially since if you're part of generation, I'm Generation X. Okay, I was born in 1980. Generation Y was shortly after that, in the late 80s, I want to say, Generation Y. And Generation Y doesn't seem to remember a lot of the same things we do with the effects. I've noticed that.
You know,
so,
I have my own son and my nephew. They have memories of Pikachu's tail being different. They have memories of Curious George having a tail. So even my child and my nephew are affected. And you know, I was just telling you about my friend. My friend is only 1 year older than I, and he has a memory from childhood. He's like, you don't remember the commercials? Choosy moms choose Jif. And he was like, from the time I was a little kid. And see, that's what's so crazy to me, is because I just remember it always being Jiffy. But he is so close to my age, and I grew up with this.
Oh my God! So he remembers Jif.
Yes.
Oh my
that's
God!
Why I'm
Wow.
And I mean, he's adamant that he's like, I can remember the commercials when I was a kid. Don't you remember? And he was just as adamant as I am about some of the other things, you know?
Yeah.
And I can't quite figure out why that.
I wanted to ask you something.
Again, I keep having to come back to, it's got to be something about which consciousness you end up with as far as your dominant consciousness, or maybe memories, and your, you know, I mean, I don't know. I really can't. I can't explain this stuff.
I don't know either. And there seems to be something else that's running around rampant too. Is like ADHD and autism. Before 1980s, none of this existed, or it did, but it was in small numbers. But now we have so many kids these days that are diagnosed with ADHD and high-level autism. It's crazy. It's off the charts. My son was diagnosed with it. I have ADHD to some degree, and it's affecting his learning because he gets bored with a lot of the math and what's in school these days. Whatever they teach him, I don't know, but it seems to be running around a lot. Do you have any theories on that? Is that part of maybe a side effect of the Mandelas? Could be ADHD and autism, or could it be something deeper? And I know that's a lot at once.
A bright child who's easily bored and distractible because he's bored. And so they refer for diagnosis. And I can speak from personal experience about this. My child was referred by a teacher. And, you know, my child had straight A's. He had no problems as far as anything goes, except socially, I will admit he was a little immature. But, I mean, academically, he was doing fantastic. And so we went to go see somebody, and I walked in, and all I did was I told this mental health professional that, you know, the teacher says that my son is distractible, and, you know, I don't know that I agree. And, you know, this mental health professional wrote out a prescription without ever even setting eyes on my son, based on just that statement.
What?
Yes. That this mental health professional, because I walked into her office and said a teacher referred us, but I don't think this is a problem. And she wrote out a prescription. And she was going to write that diagnosis. And I said, what are you doing? And she's like, well, you just told me that your son has. And I said, no, I did not. I told you that his teacher thinks there's a problem, but that I don't. And she's like, well, you know, I'm just treating what you told me. I said, no, you're treating what a person who's not here said that I just told you I don't agree with. And anyway, those are the types of things where I think that the mental health community is over-prescribing. They're not doing the proper testing. And that's one of the reasons why you see this rise. The other reason, again, like I said, there are more children that are being diagnosed because people are aware of the problem. Educators have been trained to spot the symptoms now. Parents are more aware. Like, this was not widely known about, but my own brother, when I was a child, this is like 1982, he got diagnosed with attention deficit disorder. And he was in that small, tiny percentage that actually got diagnosed back then. And so it's not that these are new problems that have just been found out about. These are problems that existed but were not treated or recognized. And now you have an over-prescribing and over-diagnosing problem on top of having more awareness. So you're seeing that. And also the other thing I think it could be attributed to is diet. I think that children are receiving a lot of chemicals and they're receiving a lot of sugar, and I don't think that we can completely write off the effects of all of this processed food in our children's diets and in our own diets. There's been a dramatic rise in childhood cancer that was going on before I think the Mandela effect had ever been identified. And I think it has to do with processed food. There is one study, at least, that linked, it was statistically significant, but they can't say it. There's not necessarily a causality link.
Exactly.
But there's a link between childhood cancer and hot dogs. That's the only study that has been able to definitively say that children who ate lots of hot dogs were statistically more likely to have a childhood cancer.
I ate hot dogs today.
Well, I mean, like I said, this is not definitive. It's not showing causality. It's not saying that hot dogs cause cancer. What it's saying is that the study group did find that they interviewed all these, parents who had children that were healthy and all these parents who had children that were diagnosed with cancer, and they asked all manner of questions about their diet. And the only thing that came up with a slight statistical significance. And when I talk about statistical significance, that's talking about something very specific. There has to be, you always have in statistics like a plus or minus for error. Do you see what I'm saying? But if it rises above that margin, then it becomes statistically significant. And the only dietary commonality that they could find was hot dogs. Again, that doesn't prove anything. It's just something that they're reporting.
Yeah, and see, I've heard that nitrates, which are found in hot dogs, actually do cause cancer. I've heard of that somewhere. I'm not sure where, but I think kids are avoiding broccoli too. They're not eating as healthy. My kids, because they grew up on McDonald's Happy Meals, honestly, that was not 100% my doing. I will say. But that was all they, like, my son would eat for a while, like chicken nuggets from McDonald's, and it's pretty awful. And then it took the nurse practitioner and the doctor, both of them agreed that, you know, you have to feed kids right to develop their brains and grow properly. They have to have the right nutrients, and you can't just expect vitamins. Like, vitamin intake is great, but it's a supplement. It's not meant to carry you through the day. Am I right?
Right. Well, yeah, people think that if they give their child a one-a-day Flintstones vitamin or a vitamin, that they're getting everything they need, and that's not necessarily the case because, I mean, it's shown over and over and over again that the foods allow the absorption because they'll also contain another vitamin that helps absorb the vitamin that they need. Do you see what I'm saying?
Exactly.
So they're interacting, and it's absolutely, you know, definitely 100%. You should be, you know, teaching children. You know what a good rule of thumb is? The less of food that you're feeding your child resembles a real plant or animal that is consumable, the less it resembles it, the more processed it is, and the worse it is for them. Does that make sense?
It does. It has to look and feel like the real thing, I guess. It can't be virtualized, like or fake. If you have an actual ham that you cook in an oven and you cut it up, it still resembles meat. But then when you get those processed deli ham things in the little plastic bags, I'm not going to name any names by, you know, I don't want to make any companies angry, but it's not the same. You see what I mean? There's water and everything pumped into that, like you were talking about, nitrates. It's to keep the food color. Like on the meat has to appear red. Nobody's going to buy meat that looks grayish, but they have to put chemical in there to keep it looking red after they cut the meat. So that's what they do. And like there are certain things like I think it's one of the red dyes, red number 9. I can't remember the number. I think it's red number 5. It's like it's made from beetles, isn't it? Like a red beetle.
I can't remember what number the red dye is, but it's outlawed in Europe. They will not allow that dye, that food color, to go into any of the foods in Europe because it was shown to be so harmful.
Yes.
And, what is it? What is the saccharin? I think it's saccharin. Saccharin was one of the artificial sweeteners was linked to cancer, and they don't allow it in Europe. I can't remember whether it was saccharin or the other one. But anyway, y'all can look dietary stuff up later. My point is that our FDA is not doing the same job that other civilized countries' FDAs are doing. They're equivalent of their FDA. It's not necessarily called the FDA over there, but they're actually keeping shown to be harmful off the market there, whereas in the United States you have lobbyists that are basically buying off legislature, and they're just approving products that have already been shown to be unsafe. And so you do have to research some of this stuff. We can't rely completely on our Food and Drug Administration to do
exactly.
It for us.
And we all know that's a Mandela. Have you seen the FDA logo?
No.
The A looks messed up. It looks like one of those triangle A's. It's like they've always been in on it. But and I hear people telling me about the quality of their drinking water is not that great anymore. Like you would think with the EPA and everybody else that we would have this pure drinking water. It's like they mess it up on purpose.
Michigan showed that's not the case.
What?
Flint, Michigan is proof that you cannot count on the EPA or anybody else to protect your water source. I mean,
no.
Are you familiar with you've heard about the Flint, Michigan water, right?
No. Can you tell us tell me and the viewers?
Well, I thought it was pretty common knowledge by now. It was even a topic on the debates, the presidential debates, that the Flint water supply was not safe. And anyway, I'm not going to go into great detail, but it was basically known about and nothing was done about it.
Oh my God.
And it was, yeah, it's just basically the, people who are getting money for not doing anything about something. You can look at, you have cases, isolated cases. I don't think it's a big government conspiracy. I just think that was an isolated case where the government knew about it and did nothing. As a government official in particular, you can learn about that on your own. But I don't think that, I'm not big into the mass conspiracy theories. Honestly, I don't think any branch of our government is organized enough to carry out a conspiracy theory that is on a mass scale, like the Mandela effect, That's just not I just can't see that happening, especially since it's happening all over the world and it's happening with geography, it's happening with human anatomy. That is not, in my opinion, it's not man-made, if that makes sense. Or
yes.
It might have been created accidentally with the CERN Large Hadron Collider. And the only reason I say that, I do want to throw this out there. Can you guys still hear me?
Yes, I can hear you.
Yes.
We got about 5 more minutes, guys. We're going to have to, because we've been on here for quite a while, and I'm sure you probably heard the dinner bell in the background there. So, yeah, we're going to tie it down to about 5 more minutes, okay? Go ahead. Sorry, Jessica, to interrupt you. Go ahead. Can you hear me?
The hydrogen collider, yep. The CERN thing?
I can't hear her.
They're opening holes.
Well,
wow.
Jessica, I'm not sure if you can hear me. We're about out of time.
Perfect.
Jessica, she's having trouble. If you can't hear me, go ahead and reconnect.
I can hear you. We can hear you. Yes, I can hear everybody.
You can hear her too?
Yes, yes.
Okay, because I for some reason I can't hear her. Can you relay?
I can hear her. She's talking about the collider.
Okay.
Particles, yes. Mm-hmm.
Can you relay what she's saying?
Yes. Give her 20 seconds.
Okay.
She's talking about particles, right? Atoms. Atoms. Smashing atoms at accelerating rate. Yes. The elements that cause the Big Bang, that's what they're trying to find out. Correct?
Yep. I've got to prepare for the hurricane coming. You guys, we really need to have some special intentions, for anyone who's in the affected area, anywhere on the East Coast.
Brian, she's trying to explain.
Okay, I know, but I can't hear her. None of the listeners can hear her.
Did you know that Brian also has a live show, usually on Fridays as well? Yes, he usually has a show on Friday where we have guests, and you don't have to give your name or anything, and if you don't want to show your face, like me, I don't do it because my internet's not strong enough, even though everybody knows my name is Teresa. But you could still come on the show, right, Brian? Brian?
Yeah.
You still there?
Yeah, I'm here. If we I'm not sure if we're doing a show right now. It's kind of up in the air with Friday because the storm is coming this way. I think.
Hurricane, he said, whether or not we're going to do a show Friday or not.
But I will tell you guys out there. I'll tell my listeners. So I'll be doing a video about it. If we're not able to do this week, it's going to be a bye week because of the hurricane.
Yeah, it all has to do with the hurricane because he is in Georgia and he could be slammed by this. And normally on Fridays he has one around because he's 3 hours ahead of us, so it's like 6:30 my time. Excuse me, because I'm in Las Vegas. I'm in Nevada, so it's 4 o'clock for me.
But
yeah. Yes.
What's she saying?
Okay, Brian, she wants you to disconnect.
Okay. All right. Well, yes. Disconnect.
But if you disconnect, will it disconnect me?
It shouldn't. Can you guys hear me?
Big Bang is pretty much accepted by like 95% of scientists as the way our universe was created. So
yes, Big Bang.
And what the Big Bang is it's saying that all of our universe was created from like something smaller than an atom. Okay, so here's something just to throw out there if you want to throw this at Brian and see what he thinks about this.
Yeah, I can hear you now. I reconnected. I can hear you guys now.
You are smashing atoms together at an accelerated rate of speed, and you know that the Big Bang occurred, and it basically means that the entire universe was contained in less than the size of an atom, then, you know, what I'm saying is you're dealing with two atoms smashing them together. Well, you've already admitted, you're already accepting that the entire universe came from something smaller than an atom. So then why, you know, wouldn't it be completely plausible for smashing atoms together at slightly less than the speed of light or whatever? I'm not sure exactly how fast, don't quote me on that. But if you're smashing atoms together at a super high rate of speed, as fast as they can accelerate it, you think it would be very plausible for there to be some sort of reaction that was a large reaction like the Mandela effect from something like that, a side effect? Right?
That's what I thought too. I thought CERN's probably the one who caused all this mess, and they can't clean it up.
Right, and see, that's the thing is, I don't even think that they intended on this. I don't think they foresaw this. I don't think they had any idea this would happen. I think that they are doing exactly what they said they were going to try to do, which is just try to understand the Big Bang and maybe some of the elements that were created in those first moments before inflation.
But they caused all these repercussions. These repercussions of history changes and logos and everything has been affected. They caused a big mess.
Now, I can't say for certain, but I do know that the Mandela effect really wasn't noticed until fairly recently. And, you know, the CERN and the Large Hadron Collider didn't really exist a long time ago either. You see what I'm saying? It is kind of coincidental that we are having all this Mandela effect changes around, and they started approximately the same time CERN started their experiments.
Exactly, you know? And we are how many days away? We're like just shy of 3 weeks away from September 23rd, which they're all claiming is.
You might not be aware of that date.
Okay,
you might want to explain that to her.
September 23rd is the Revelation 12 sign. It's the Revelation 12 sign.
Yeah, I read it. I read that in detail. Yeah. But I also know that they predicted the end of the world in September 2009, September 2011, September 2012. Now, I do understand that they're saying this one is different because of in astronomy, the changes in the sky. And, you know, but I don't know if I can put a whole lot of weight into it.
We were supposed to die in December 2012.
Exactly. I wouldn't exactly go and sell all your stocks and bonds and everything like some people are going to do and jump out of buildings and crap like that. You know, this isn't like we're going to be, I don't think we're going to be dead. I do think that something is going to happen on the 23rd of September. We're just not sure what.
Right. Well, it's just an idea, is that perhaps, you know, if the entire universe was created smaller than an atom and they're smashing these together at super high speeds, then, you know, maybe you're going to have some unintended side effects.
Cause and effect. Isn't that what they call it?
Yeah. Well, I don't think it was intentional.
Like a chain reaction, like dominoes.
And if they continue with their activities, and that is really what's happening, then we'll just see it get worse until most people are affected.
I think this is, now, you might not be with me on this, but I think this is the great spiritual awakening that Moneybag 73 was referring to. And a lot of Thessalonians, it talks about, you know, these things. And I don't know, there's been Bible changes left and right. We're seeing a lot of, but that's for a whole nother show. But I do want to thank you, Jessica, for coming forward, because I've been trying to find somebody who would talk to me, anybody who would talk to me about the Mandela in the medical field. It's very hard to find people.
Oh yeah, that's because we have licenses to lose.
Yes.
Exactly. And I'm really thankful to be gathered with you for this discussion, and you're always welcome aboard our future discussions. You know, if you ever want to jump in and do the Hangouts with us, it's very simple. I could teach you how to do it.
You have to teach me.
Yeah, no worries. That's my field. I'm an IT guy, so you know, I don't mind sharing my knowledge. And I mean, you've shared with us so much today. I'm very thankful.
Well, I appreciate it. I thought it was fun. It's fun to
I really enjoyed it.
Yeah. You guys are the first people I've gotten to talk to outside of my husband that feels affected the way I do, that are like real life people talking to me and not people online that I'm typing back and forth with.
Well, I'm very glad
This is very
too.
much real to us. This is like our life every day, right, Brian?
It has become.
I mean, I literally
like,
spend my lunch hour every day at work looking for residue. That's what my whole life every day at work is doing, is looking at residue. And I kind of ignore my boss next to me because, what are you doing, looking for your Mandela effects? I'm like, yeah, it's my lunch hour.
Right.
Yeah, it's
slip up a few times saying, oh yeah, the monocle. And I'm like, you do remember the monocle, yeah.
Well, thanks for inviting me on and having me. I really appreciate it. It was fun.
Yeah, definitely.
Will you definitely come on a future show on a Friday? I mean, you know,
I'm sure
email and everything, right?
Yeah, I'm sure you're familiar with Dr. Lupo. I think it would be a great discussion. Maybe we could get Dr. Lupo in on it. Maybe Meigs. Yeah, she's. Yep, you know Meigs, don't you?
We're just here to observe. We are here to state we have evidence, but we don't have a culprit. We don't have we have what could be a few or several culprits, but we don't know what it is. So that's our stance. We're just taking the evidence into consideration, and we see some patterns forming, but we don't know what the real thing is that's causing it, and whether you know, God is allowing this to happen. Yes, you're right. And
well, I've seen some pretty really out there theories. Like
well,
there are
God,
people.
Everybody thinks. Hold on, real quick.
Okay.
Because God thinks that. I mean, people think that God is this benevolent being. He is, but He will come and destroy a nation if it's out of control. That's what He does throughout history. If you look in the Bible, people who read the Bible need to know that He is coming with He's coming with wrath. You know that, right?
Yeah, well, yeah, I mean, the Bible says that obviously there's going to be a second coming and that there will be judgment. And Judgment Day, that's why it's called Judgment Day. You know, as far as that goes, personally, I feel like, and I mean, you may feel completely differently than I do about this, but I feel like as soon as you step into discussing Mandela Effect in a spiritual context, you lose an enormous number of people who give it any credence or a second thought after that, because they aren't spiritual, they're atheists, or their belief system is different. Maybe they're Muslim, maybe they're Hindu. I don't know, but I'm just for me personally, that's how I see it. And I mean, I honestly have a much wider view than just. I feel like there's just one God, and that each individual religion popped up in different geographical locations on the globe as a way of trying to connect to that God, so that I don't really think there's much of a difference between what Muslim people call Allah and what we call God. It's all one God, and I still that's my basic belief. And some people will say, well, then you're not a Christian. Well, then you don't have to think I'm a Christian, but I feel like I'm a Christian, because I also believe in Jesus Christ, and that Jesus Christ was his only son down for us,
Yes.
So, I don't know. I mean, I don't want to get into all that, but I was just going to go over.
It's fine. So basically, from what I could hear, and I'm getting this vibe that some of the Christians that you're speaking with have sort of alienated you, and some of the non-Christians have as well. Is that right?
Well, no, not really any non-Christians.
No?
I think that it's, I live in, the Bible Belt in Tennessee, and...
Yeah, I'm not far. I'm in Georgia. I'm trying to get up there this weekend to get away from the hurricane.
Right. Well, yeah, you need to be safe about that. That's really bad. I just saw that it was, something on the Weather Channel saying it's the largest, the strongest hurricane on record in the Atlantic Basin.
Yeah, how does this happen if it's not man-made?
Well, I mean, as far as are you talking about the Mandela Effect or weather patterns?
No. I mean, people are saying that the government knows how to control, weather. And yes, I think that's a good thing that they can control weather sometimes, because maybe I've heard they have something here at the base that knocks out storms. They use microwave energy to do that.
Right. Yeah, but then again, when you go down that road, then you're basically talking about conspiracy theories. And
exactly.
Honestly, I don't think the government is organized enough to carry out a massive conspiracy on that type of scale.
And right.
As an international effort between multiple nations.
Yes, and a lot of Christians and other people feel that they're going to be pushing this chip. So be very careful not to take anything in your hand that could be easily scanned. Something to do with these chips could be hackable. I really think that these chips are going to have a sort of like a backlash, maybe. I mean, it's just a theory of mine that kind of like Attack of the Clones. You remember the Clone Wars? Yeah. Actually, you remember Star Wars where they say execute Order 66, and then next thing you know, everybody goes haywire because they're being programmed by a chip.
Right. There's a movie out recently that just came out like that, where everybody's trapped in a building, and they submitted to or agreed to like medical whatever, and they all had this device implanted in the back of their necks or whatever, and it was something that exploded when they didn't follow directions. It was, I don't remember, it was something like they were all, I don't know, it just came out not too long ago.
Yeah, I was going to ask you, I think I know which one you're talking about. I actually have it up on my Google Drive. Is it the one about the game, something about the mind gamers or something? Is that the one?
It wasn't called Mind Gamers. It was very recent. The building went on a lockdown, and like all the windows shuttered with metal plates, and then they were announced saying, you have to kill so many people.
Yeah, you're talking about the Gecko experiment or the
Yeah, the Belko experiment. That was it. Yeah. But no, I don't, I do believe that, there was just a recent case where some employers were offering a voluntary thing to the employees who wanted to have a microchip. If they wanted one, they could get a microchip implanted that would allow them easier access through doors and to pay for meals. And everybody freaked saying, oh, they're going to start microchipping everybody. But it was completely voluntary and it was no reaction. However, I do think that in the future, I've already watched, a lot of the science programs that talk about, Have you seen, what's it called? The Year Million? Have you seen that show?
No, I don't think so.
Look up a show called Year Million, and they get actual scientists that are reputable and recognized in their field, and they talk about the advances humankind is headed towards. And Year Million isn't an actual year. They're not talking about the year million AD. They're just, Year Million is a way of saying in the far distant future. And what they do is they break down each scenario. Like the first whole episode was all about AI and the advances that were being made in AI. And then the next one dealt with something else. And the next one dealt with something else. And like they're talking about a post-human existence, which means that that's basically when you get rid of your human bodies and you can upload your own consciousness and all your memories into a computer and live in a digital world. And it's really interesting stuff, but it's completely based in science. And they talk about how in the far distant future, this is where we're headed. This is where things would be possible. If we don't blow ourselves all up before then or die by an asteroid or whatever, they say these are things that will happen at some point in the future because we can already see how these things are possible. It's a very, very interesting show. It's kind of scary too, especially when, like, the opening scene of the very first episode, their daughter, like, I think they were in a car wreck and their daughter died on the scene, and this drone appeared and asked AI, and they only had minutes to decide because her brain activity and everything had to be noted before she completely, like, had been dead for 5 or 6 minutes. You know how they say if you're not resuscitated in the first 6 minutes, you're not going to survive?
Mm-hmm.
Well, this drone just showed up at the scene of the wreck and said, you have 5 minutes to decide, do you want your daughter to be uploaded to an AI? And the family decided yes. And then they uploaded their daughter, like, all of her memories from the time she was a small child till that current state when she died.
Wait, what movie is that?
It's not a movie, it's a series. And there's only 6 episodes.
Well, what series is it?
It's called Year Million.
Is it like the number million, or is it like the word million?
I think it's the word. I could be wrong.
Okay, I'll check it out. That's a TV
But yeah,
series.
anyway, it was kind of weird because that was like the very opening scene of the very first episode of the season, of the whole thing. And it was kind of crazy. I was like, wow, that would be, what a horrible decision, you know?
Yeah, I was...
You ask me, why, you know, how or why do you think this is happening? What I'm going to say is I'm going to say that I study science and that I have always been able to reconcile my scientific beliefs with my spiritual ones, and that even though I'm a big believer in God, God still has a mechanism for how He makes things happen. Right. And that, you know, in this regard, I think that God is the creator, and that basically we are.
Well, and then I could go with well, you know, science seems like they've always tried to disprove God. But,
well, yeah, and there's no way. Yeah, that's what I'm saying. Though, is like the deeper you get into science, the more you have to acknowledge the existence of God. And if you listen to what any of the real deep-thinking theoretical physicists are saying, that's what they're saying. You know, Neil deGrasse Tyson, he's an astrophysicist. I mean, basically the only person, and even Stephen Hawking said that he doesn't think heaven can exist as an actual physical location in the universe. And that might be true, but even Stephen Hawking said that he hopes there is a God. Even he was like, that he hopes there is. Do you see what I'm saying?
Yeah.
Like, every single one of them, if they don't outright acknowledge that they believe in God, then they're, at least in Hawking's case, he says that he certainly hopes there is, you know? So I just don't think people understand really that there are, that the people who are really on the cutting edge of finding out about the universe and really, that theory of everything that they're after, it keeps pointing towards the existence of a creator. That's it.
Yeah, and here's the thing that I don't think a lot of people realize. Rene Descartes, you know, he was famous too for his quote, "I think, therefore I am." What does Jesus Christ say he is?
Well, that's the thing. Is he's not only scientist, but he also said, I mean, I think, therefore I am. That's consciousness. He's describing consciousness, and that's the very fundamental basis of quantum physics. Was the double slit experiment that said, by our very act of observing, the conscious observer changes reality, and you know that's
like really smart, you know. I'm nowhere near as smart as you are when it comes to this stuff. I just observe mainly. Me and Teresa, I mean, she's all over it, so am I.
For me, that was it. The big thing for me, the clincher of the whole deal with the Mandela effect, was the change in the location of the kidneys. Because of my trauma background, and we had something called open abdomens, which means that, like, if somebody gets a gunshot wound to the abdomen, and it tears up their intestines, or they have multiple gunshot wounds, and there's multiple places that need to be repaired, the risk is so great of there being peritonitis, which is just the inflammation inside the abdomen, and also the swelling, that they leave them open. And what they do is they just clean them out really, really thoroughly after they think they've repaired everything with sterile saline, and then they slap this very, very thin, transparent dressing across the top called a tegaderm. And you'll be familiar with those because they are the same dressings that are on top of your IV site. If you have an IV in your arm, you know, those super thin, transparent dressings that stick to you like a second skin? It's like saran wrap, but sticky. Those are the dressings that they put on these abdomens. And when they cover those abdomens up with that, you have a perfectly clear view of the internal organs. And that allows for the swelling to occur, because if they don't leave them open and there's a lot of swelling, if there's massive swelling internally, like we had one guy whose stomach was hacked up with a machete, and they repaired everything and they left him open to swell, and his internal organs in his gut swelled outside the abdominal cavity capacity. So if they hadn't left him open, then it would have compressed the intestines and caused ischemia, which is a lack of oxygen because it's so compressed that no oxygen could get through. And that would have caused necrosis, which is tissue death. And then you can kill your patient. So that's why they left these guys open, like anybody who, and I say guys because it seems like there's always men getting shot and stabbed and cut up. I never had a female patient that was a gunshot wound victim. They were all male. But anyway, I just wanted to say that they left these people open. So I was intimately aware of where the internal organs were located because I worked over a year in this trauma ICU, and it was commonplace to have patients who had open abdomens. And, you know, if that happened, you could have a clear visual sight line to where the kidneys were. So I know where the kidneys were. I didn't forget. I didn't get mixed up. I didn't read it in a book somewhere. I saw it on a regular basis for over a year of working in trauma ICU. And, you know, that's where I had learned they were in anatomy class 17 years ago. And they never changed location. But then I got out of the trauma ICU and I started working at a community hospital, and then I went out to the prison, and the prison had lots of trauma. I mean, there were stabbings frequently, but you know, you didn't actually see the internal organs usually, or if you did, it would be like a piece of an intestine sticking out, and you would just, you know, slap your gauze on it and send them out as quickly as you could. But it was during my time in the trauma ICU that I became so aware of where the internal organs were, because you could see them. You know, it wasn't every single patient, it wasn't every single day, but we would typically, in the ICU, you would have at least one open abdomen patient somewhere on the unit, if not more. So, I mean, you can't forget something like that. I've also seen organs harvested, you know, for, you know, patients that had become brain dead and the family wanted to become donors, you know, for their family member to donate their organs. And I've seen organ harvesting done. So I just That was it for me. When I found out the kidneys were not where I'd learned they were and where I'd seen that they were, that was it. I was like, okay, you know, I might be wrong about whether there was an S on the end of Sally Field or not, but I'm not wrong about where the kidneys were. That's my profession. That's my job. And I evaluated patients on a regular basis in the prison sick call. And you know, if they were having kidney stones, that pain was located below the waistline.
Yes.
Every single time.